Hey, Jim Hoffman here for EMS Office Hours and your Monday Minutes. This is continuing on with our EMS quick study tips and help, and episode 32. Can keep going on here with the poisoning and overdose section here, and the assessment and the different types of poisonings or overdose that you might see in the field. And of course, I always like to mention why this stuff is important. Very important, of course, for exam prep, right? These Monday Minutes, these EMS quick study helps are just that. They're quick study helps and tips that are going to give you things that are very common that you will see on many EMS exams throughout your career. But on top of the exam prep, guys, I always try to stress it's also good to know this stuff. It's going to help you with your clinical impression of the patient, with your assessments, with your documentation, and with your interaction. So it all kind of ties in together, okay? And of course, I encourage you that as we go through these, and since these are quick little segments here, and you can pretty much do full hour presentations on these types of topics, that if you don't understand something, if something is not clear to you, to go ahead and research it in something like your textbook, look online for resources there, or use something like paramedic.com that offers a lot of online resources there. Okay, so today, like I mentioned last week, we're going to talk about carbon monoxide poisoning. And a lot of this stuff you guys probably already know, right? It's colorless, it's odorless, it's tasteless, it's really a non-irritating type of a gas, okay? The gas heaters usually the most common sources of domestic carbon monoxide poisoning, right? That CO alarm that you get called to because they call the fire department, and you get called because they say maybe they have some sort of sign or symptom, right? Maybe they're feeling dizzy or something like that. They're short of breath, so you get called because the fire department's going for a CO alarm. The CO detector has gone off, right? That's the most common thing when it comes to domestic sort of exposure. Now, that whole binding thing, right? You hear this all the time. This is the type of thing you hear, oh, CO binds to, hemoglobin much better. And actually, that's what it is, and why we have such an issue with it in the field when you have patients that might be exposed to carbon monoxide, right? Because it does. It binds to hemoglobin about 250 times more, okay, than oxygen. And oxygen, that means oxygen can't get in there, okay? So what's happened? The patient's suffocating. Well, not really suffocating, but suffocating really on a cellular level, okay? So when we assess these patients, you really should suspect carbon monoxide poisoning in someone with an alarm going off, but also our firefighters and responders that might be in a fire, or a patient that might have been in a fire, or even patients or firefighters and first responders who have just been in some sort of a heavy smoke incident, especially if it's sort of a closed space, right? And remember, your SpO2 detector is not going to let you know if they are exposed or have high CO levels, okay? Many agencies now are carrying CO detectors that you can put on patients and get your readings, right? A lot of places, maybe you might have it on the ambulance, but a lot of places supervisors have it, or fire departments have it, fire captains have it, fire chiefs have it to check their personnel. So find out if somebody has it. If you don't sure if somebody you know where you work, either your agency or maybe your fire department or whatever might have these detectors, find out if they have them. This way, if you get responding to these type of calls and you suspect carbon monoxide poisoning, you can have the patient checked that way and kind of sort of increase your suspicion that their signs or symptoms might be coming from carbon monoxide poisoning. So when we're talking about this, right, what are some of the things we're looking for? Well, there's kind of a whole range of things, and unfortunately for us in EMS, a lot of times these things, right, we are many patients experience the same signs and symptoms for various reasons, right? Not necessarily carbon monoxide. So put everything together, where they're exposed, where they were, was there a CO alarm going off, stuff like that. But some common things you'll see with carbon monoxide poisoning: malaise, weakness, headaches, nausea, shortness of breath, confusion or dizziness. They might even be unconscious, right, or be very lethargic or drowsy. Some other things to look out for: even chest pain, think about the lack of oxygen the patient's getting, right? Could develop into an MI or even a pulmonary embolus. Think about your patient's age and history. Okay, are they going to be susceptible to that type of stuff? Now, I put cherry red skin here because it's something we all hear when we talk about carbon monoxide poisoning, but this is really a later sign. But you can see it. Okay, so it's worth mentioning. Talking about shortness of breath, I want to bring this back around. Check to see if they're short of breath. Do they listen to lung sound? Do they have rales or maybe even rhonchi? Okay, and patients could develop seizures or even blisters at some point. So these are all types of things you need to keep an eye out for when it comes to your signs and symptoms of patients that might be exposed to this. You might see some of these or all of these. For me, in my experience in EMS and the patients that I've had exposed to this, I've had everything from the malaise and the weakness and confusion and nausea, not really so much short of breath, but I have had the lethargy. I've had patients who have had seizures actually. And those are the things that you can see. And again, putting it all together, getting a bigger clinical picture of what's going on with your patient, right? Of course, our management is our safety, of course, removing patients from the scenes and their safety as well, getting them into fresh air, okay? Protecting those ABCs, right? You're protecting that airway, protecting the breathing, managing that stuff, treating the patient's symptoms, giving them, oxygen, ventilating them if they need to be, even airway management if you have to, as far as even intubating these patients, right, if necessary. And you want to transport them to the hospital for further evaluation, and of course the IV. Now IV, not much you're going to give them for it, and most hospitals are going to be getting blood gases for these patients from a arterial blood gas. I'm going to tell you, many years ago, I was in a big scenario where I was exposed to carbon monoxide, and they had to do arterial blood gas on me and my partner because we were both exposed to it. Not very pleasant experience, I will say, but it is something that the hospital will probably do for these patients if they're experiencing signs and symptoms that we mentioned before, and there's a high suspicion of them, having carbon monoxide poisoning. All right, so that's it for this episode, guys. Real quick, right? Not a lot going on here, but I like keeping these nice and short chunks for you to kind of really focus in on this content. Okay, and of course, if you know this content and you kind of just breeze through it, that's great. And as we get further and further into these Monday Minutes and these EMS quick study tips and help, I think you're going to find more and more content that you're going to be able to relate to what you do every day in the field. And also, I'm hoping, again, that you will go and seek out more information and really master this content and be a much, much better EMS provider and EMS professional. Okay, next week, we're going to talk about the tricyclic antidepressants, okay? Things like, different types of drugs that you're going to take for that patient. Amitriptyline is a big one, right? Doxepin is another one. Nortriptyline is one, right? All these types of drugs that patients might be taking, and then they might overdose on either intentionally or accidentally. So that's going to be next week. On the next Monday Minutes, we're going to do that. And until then, of course, I would encourage you to follow me on these various social media channels. Hook me up on Instagram. I am EMS Safe on all of these channels. But if you go to any of these links here, just type in emsseo.com and /, and just add that social media channel, and you'll see my page there, and you can join me there. Either follow me or friend me, and you'll see different content at all different sessions of these. Okay, and of course, Snapchat me, guys. I love using Snapchat. Kind of goofy, fool around a little bit there. I am at EMS Safe as well on Snapchat, so friend me there. I'd love to see you, love to engage with you and kind of share our EMS experiences day to day, even our personal stuff, guys. I love interacting with you guys and engaging in the people that follow me here on YouTube and on the blog and on the websites. All right, guys. Again, any questions, comments, concerns, send them over to me. My email is contact@emsofficehours.com. And of course, if you have any tips or suggestions for your own Monday Minutes, I'd love to create an episode based on something that you are passionate about in EMS. So send that over to me as well. All right, guys, until next time, as always, I am Jim Hoffman for EMS Office Hours and the Monday Minutes. Stay safe.